Hello to everyone who's listening. Karen and I are here, and today we're going to be kind of giving a presentation on injury prevention and longevity. Really, we want to talk to you guys about how we can help your body last as long as possible and prevent yourself against any possible future pain or injuries. So, of course, we have to start off with what occupational therapy is because we aren't physical therapists. So, we're here to help assist you in returning to pain-free functional use of your occupations, daily activities, leisure, and work. And OT is extremely critical in helping promote, general health, wellness in any environment, secondary to our holistic approach and skills in activity analysis, environment modification, and intervention planning. So what can OT do for you? So today, I want to go over and teach and highlight just basic injuries so everyone has a simple understanding, and things that we treat that can affect anyone's health and performance on a daily basis. I also want to go over, and Karen as well, to demonstrate, practice just some basic, simple, healthy stretches and exercises that will make your body last longer and improve your work and leisure experiences. And then Karen will go over and offer, some ergonomic guidelines for both home and work performance and stuff of that nature. So a few common issues that we treat on a daily basis. Gonna go over some broad categories, and I'll dive into them a little bit, but repetitive strain injuries, or RSIs, posture and pain from muscular imbalances, and then we'll also go over the workplace ergonomic portion as well that we all have to deal with. So a repetitive strain injury. So for those who are unfamiliar with this, it can be more than just a repetitive task. It can be also something due to forceful exertions, vibrations, mechanical compression, or just sustained awkward long positions. Common examples that we see here on a daily basis are tendonitis. Tennis elbow is a big one we see with that. Neurocompressions, carpal tunnel is a big one we see with that, or tenosynovitis, like dequervates. So, starting off with tendonitis and tenosynovitis treatment and prevention. First, for anyone, it's important to recognize the prolonged repetitive tasks or overuse positions that we all do on our daily basis. If you can recognize the things that may be causing you a problem, we can evaluate from there on how to treat and modify it. Breaks are going to be a huge portion with anyone's job, especially if you are doing lots of repetitive tasks, and Karen will go a little bit more into this as well. Modifying tasks is critical, especially for long sustained positions or heavy lifting. If something causes pain, don't work through it. The phrase no pain, no gain is not always true. If anything, you want to change it. More importantly, stretching and gentle strengthening can help make a difference, even though it might seem like at the time being, it might not be doing much of anything. But in the long road, it will help prevent against future pain. So with tendonitis and tenosynovitis treatment, just some basic things. So every patient is different. Everyone gets pain in different places. So I've kind of just picked some very basic general things that we see on a daily basis. And hopefully this may be able to help individuals here and kind of be useful to help prevent against some issues. As for other things, you might just need your own individual analysis, but for the sake of it, here's some basic stuff that if you are starting to get pain in a particular area, massage is great in trying to help alleviate and reduce pain and stretch out tissues. Tissues want to get tight after lots of repetitive use. Basic wrist stretching, we kind of see a lot of with tennis elbow, for example. This seems to be more of one of the common tendinitises that we come across. So a basic wrist stretch of just your arm straight and wrist going down helps at trying to reduce this and alleviate the pain, as well as start stretching out those tissues. With the thumb, we get a lot of dequervate patients, and just something as simple as bringing your thumb down and holding for a minute can help alleviate and stretch those tissues as well. So for tendon strengthening, though, I find it's critical that if everyone has a little bit more wrist strength, it can help in the overall performance of majority of all the tasks we do between carrying, lifting, computer work, stuff of that nature. So by just doing simple wrist flexion and extension exercises once a day, every couple of days, you'll overall help strengthen and prevent your tendons against possible inflammation and weakness and pain. So neurocompressions that we treat, we see lots of carpal tunnel, cubital tunnel, or you might also get numbness and tingling from poor posture. Granted, there are others, but these are just common ones. So how can we prevent? We'll go into a little bit more depth with this later, but at least for things such as cubital tunnel, by just performing more or less activities at 90 degrees or more, you will reduce the chance of getting numbness and tingling into your small and ring finger and causing pain throughout your elbow and down. Improving posture is going to also be huge in reducing the potential for a neurocompression to happen, and simple stretching. You're going to hear it time and time again, stretching, stretching, stretching. So what I have up here for everyone is just a basic nerve stretch. Nerves can get tight too. It is not something that ever seems to be discussed in basic, magazines or health shows, but a nerve can also be tight. It's not just a muscle. So I'm actually going to have everyone participate with this because we need to find out here, how tight are your nerves? So what I would like everyone to do is lift your arm 90 degrees to the side, wrist back, extend all the way out. If you are all the way extended and your hand starts going numb and tingly, you have nerve tightness. If you don't, you're doing good. Great. Anyone going numb or tingly?
Yes.
Okay, we got one person, numb and tingly. So and I went numb and tingly. So 2 people, numb and tingly, at least here. So that is just a basic indicator that, hey, your nerve is tight. Does that necessarily mean I'm going to have future problems? No, but you don't want it to necessarily get to a point to where it could become an issue and it could cause pain or loss of function. Yes?
Do you want to stretch until you have numbness or tingling?
So for the sake of the pictures, what I tell all my patients is when we're performing this exercise, you actually go right before you feel that point where it should feel like a pulling sensation throughout your arm. You go right to that point and then you just go back and forth with your arm. As a glide. Yeah. If you're causing numbness and tingling, you've gone too far and you have to stretch until you can finally get that point. And sometimes it takes a couple weeks of doing. But the end goal is you should be able to get your arm all the way out, no pull, no numbness and tingling. Okay? This is a basic one that kind of covers several different nerves. And if you just do this here and there on a daily basis, it'll prevent some nerve tightness. All right. Posture and its role preventing pain. How many of us look like this on a daily basis? So, what can poor posture lead to? Pain, neurocompression, decreased work and leisure and endurance performance, and then it can also lead to other secondary diagnoses due to an increased workload on musculoskeletal structures. So an example of this would be sometimes I find that a lot of people who may have tennis elbow is because they have such poor proximal strength and posture that they overuse their distal structure so much that it then ends up resulting in pain. So, basic stuff. What can we do for posture? So, some of these we'll do together, some we'll just talk about. A chest stretch at home. Now, depending on where you may be tight in the different chest muscles, you got to find the appropriate one for you, but simply just going in a doorway, stretching out your chest for a minute or so works marvelous at fixing your posture. Because, unfortunately, we're all mostly hunched forward all day long working at a computer, every single one of us here have tight pec muscles. I've never come across a person who doesn't have a tight pec muscle, and I'd recommend them to work on making it stronger. Second one, working our traps and our levator scap. So we all love to hike up our shoulders and sit in these awkward positions all day. Now, and then eventually that'll lead to some sort of pain in the neck and or shoulder, which is a simple stretch of either going to the side or let's actually do these together. So, and then you can see on your own how tight your own trap is. So for the trap, all I want you to do is whichever one you think may be tight, I want you to bend. So let's say we think our left one is tight. Let's bend our right ear to our right shoulder. If that feels fine, great. And you can add some extra overpressure using your hand as well. Now, that might not feel too tight in you. So then we're going to check the other muscle, the levator scap. What I would like you to do is pick a direction, turn 45 degrees, and look straight down and then put overpressure on your head. If one of these two in particular feel tight, I'd personally recommend add that part of a daily regimen, stretch out here and there to prevent against additional future neck pain and other issues. Third, massaging again. Once again, massage comes back. Massaging with a lacrosse or tennis ball works wonders. Unfortunately, we all can't afford to go to a massage therapist 3-4 times a week, hour sessions, and just be pampered. So on your own, easily just by laying down or against a wall, dig into tight, painful structures and kind of roll around and release the tissues. Next, and we're going to be doing these together. So looking around the room, I'd say I see a 50-50 on decent posture, not so decent posture. So now we need to establish what is decent posture, because we all hear it all the time. So I'm going to put some people on the spot. Dan, what do you think decent posture is? Show me. I just want you to sit what you think decent posture is.
The way you're sitting.
Like this.
Okay. AJ, what do you think is?
So straight like this. But, yeah, and then do this.
Okay. And then, well, most people here are therapists. I can't ask them. So, anyways, so when people try and most of the time show me what decent posture is, majority of the time people just either pop out their chest or extend their spine. That's not what decent posture is. Your spine should be its natural curve. Decent posture is more so what are your back muscles doing in relation to your chest and upper trap muscles. So I'm going to show everyone right now my definition, at least what I think decent posture is. Now, I can't see everyone who may be listening to this, but at least I can judge everyone in this room. So the first thing we're going to do is I want everyone to squeeze their middle shoulder blades together, kind of like pretend something's in the middle of your back, pinch or something, squeeze it together. Okay, Dan, relax again. You've picked up your shoulders. So that's okay. That's fine. But so AJ, relax. So this is the thing is most people with posture automatically use their upper traps to compensate. What we need to do is break that pattern. That's the opposite of what we want for posture. So we start with the middle squeeze. Just let your shoulders be as relaxed as you can and just try and bring them back. And you don't have to force it. Last thing you want to do is pop out your chest. Just a simple squeeze. We're going to start by just holding there. Okay? Now, what I want everyone to try to do is while holding that squeeze, I want you to imagine taking your shoulder blade and putting it in your opposite back pocket. So let's do that again. Middle squeeze, now back pocket squeeze. And now I want you to hold this. How many people think this is awkward or uncomfortable?
Yes.
Okay, thanks. One honest person. Point being, this is, in my opinion, what relatively perfect posture should be. But because we don't use these muscles often or enough, we lose that, and then eventually we enter into these areas of discomfort or trigger points along the back or shoulder or neck. So by simply performing the middle squeezes, 30 reps here and there, and your lower trap squeezes, 30 reps here and there, you will start to reorganize in your brain what posture should be and strengthen the muscles that should hold you there appropriately. So always just remember, rule of thumb, if you're hiking your shoulders, you're doing it wrong. If you're using that upper shoulder muscle, you're doing it wrong. We want to start using the middle and lower shoulder muscles.
Are you going to add that you're supposed to be in that posture whenever you're brushing your teeth, brushing your hair?
Let's be realistic, one step at a time here. All right, now Karen's going to take on over.
Thank you, Tim.
Yeah. There you go.
So I'm Karen. Some new faces I haven't met before. I'm one of the hand therapists. I'm out at the Lincoln office. So let me just switch this over here.
Nope. Cancel.
How do I get this?
Here.
Yeah. Thank you.
On the side, that's the right.
There you go.
Oh, thanks.
Long period of time.
Okay, so I'm going to talk more, just sort of expound on some of the stuff Tim has talked about and talk a little bit about positioning and so forth. So the first thing I'm going to talk about is the concept of an office athlete. So basically, this is kind of a concept that I think makes a lot of sense for the people that we deal with as patients, as well as all of us as workers. So in sports, the competitive athlete and the occupational athlete or office athlete, those terms can kind of be interchangeable. They both use their body to accomplish a task. Most of the time, sports athletes are getting paid, those athletes, but also, non-competitive athletes. But we use our physical bodies to accomplish tasks. So there's some similarities in there that we all need the best equipment, the best practices or skills, techniques, and we also need to make sure that our bodies are conditioned properly to perform our task at the level we need to. But there's some differences between these two that actually make it a little bit more difficult for the occupational athlete or office athlete. And that is that the sports athlete is often placed in their sport because of physical attributes. So maybe like a quarterback in a football team is placed there. He's really good at that sport because he's tall and he has good, excellent mobility and good foot skills, and he's got good accuracy and arm strength. But an office athlete is often placed in that position because of education or because they possess a certain skill instead of a certain physical attribute. So that can put us at a disadvantage when we're doing certain occupational tasks because our bodies maybe aren't designed, maybe we're a little shorter or taller or something like that. A sports athlete is usually competing 1 to 2 hours usually in a competition. Our days are 8 to 12. Especially around here, we work 10-hour days a lot of times. So it's 12 hours, but while we're, performing our work tasks and getting to and from work, and all those things take their toll. A typical sports athlete is going to work, 5 to 10 years in their profession, maybe a little more for baseball players. But for us, it's 20, 30 years doing the same job over and over again. Another concept is the dynamic versus static work. Dynamic work involves increased pulmonary ventilation, increased cardiac output and heart rate. So these sports athletes are using their body. They're using those pumps in their lungs, and they're getting better blood flow to their muscles. They're getting better delivery of nutrients and better removal of waste products from their muscle tissues. We're not getting that when we're doing static work. We have some dynamic work when we're typing, with our fingers and forearms, but basically we're sitting still. And so our body is at a disadvantage there as far as getting nutrients and getting blood. So the concept of us being an athlete is important to think about. We need to stay in good physical condition. We need to make sure we move throughout the day. And we're going to talk about that a little bit more as we move forward here. But this concept of, you go to work and you're performing at a high level and you need to be prepared for that. In the past, we used to use typewriters, and we'd file hard copies. So the office worker would get up and they would, shift put the paper in the machine, they'd put the carriage over and they'd use some upper body movements and they'd file those hard copies in a file folder and they'd get up and they'd pull those files open. We just don't do those things anymore. We're so digital that it's just mouse clicks and arm movement. It doesn't really require that much gross motor movement. So we need to really be thinking about that, and what we're doing to our bodies. And then a lot of us will go and do CrossFit, after work. You sit still all day and then you go and work out at a high level. And that dichotomy is a little tough on our bodies. Next concept is the concept of a power zone. There's an advantageous or best possible position in which to work. This position will cause the least amount of stress on the joints and the muscles in the body. And this position will also minimize fatigue. So if you think about it, there's going to be a vertical power zone as well as a horizontal power zone. So vertically, it's going to be basically between your waist and your shoulder level, and your elbows will be at 90 degrees. So if you're standing, anytime you're going over your head, it's going to be more difficult on your tissues. Anytime you're leaning forward, you have to bend down. There's more strain on your lumbar spine, your discs, your cervical spine as well. But overhead, especially for vertically challenged people, it's a lot of force above the head, a lot of strain on the shoulder and neck as well. So we want to think about that power zone and our best possible position to work in. So what is that position? So here's our little model guy, and we want to kind of look like he does in his workstation. He's got his ears are between his shoulders, and that's really important to minimize neck and shoulder strain. His arms are at his side. Arm rests are not always the best thing, but in this case, he looks pretty good. His wrists are in neutral. His hips, ankles, and knees are in neutral. There's some space between the keyboard here, or the table, and his legs, so it's not scrunching on the top of his thighs. His monitor looks at a good level. We're going to talk about that a little bit more. So one of the things so how do we get into this position? Well, the first thing we do is measure our chair. We put our chair in the right position, because everything else, hopefully, we can adjust a little bit. So we measure our chair, we put our chair in the right spot. And one other thing is too, we want to think about the backrest. The backrest is labeled that or called that because the back should be resting on it. And that's what helps take some of the forces off our muscles and joints, because we can kind of lean back into that chair a little bit. So the seat pan is another thing that you want to think about too. You don't want the edge here of the seat to be placed right up against the back of your knees, because you have nerves and arteries and veins that run in that area, and you certainly don't want pressure on that. So having a little bit of a curved seat and then not having pressure right up against that fossa right there is good planning as well. The other thing some people can do, you want to ease into this, but you can place the angle of your seat a little lower in the front than in the back, so that it kind of forces you to sit up a little bit taller. It takes some of the strain off your lower back, and it kind of pushes you into that posterior pelvic tilt and a little bit more of a lordotic curve. We all have this little curve right here in our back. So if you're going to do this, do it in small increments, so it doesn't force you out of your chair. You don't want to feel like you're falling out of your chair, but a little bit of lower tilt in the front, if your seat pan is adjustable, of course, would help you with getting into a better posture. As far as measuring the keyboard, the best thing to do is to measure from the elbow to the floor. So just at the tape measure, just measure from here down to the floor, and then you want to subtract about 2 to 3 inches. And that would help you decide where your keyboard should be and where your workstation height should be. Because the keyboard's got some width to it, so you want to account for that. And that's where that 2 to 3 inches subtraction from that measurement comes in. If the keyboard is too high, you're going to end up hiking those shoulders, just like Tim was talking about, or you end up in this chicken wing position where your arms kind of come out to the side. And neither one of those two positions is really going to be beneficial in the long term. It'll just cause more tension in those muscles. One interesting thing to think about, they did a study where they calculated how much force the fingers were using to type in a typical worker. So a typical worker, again, being someone that types 50 words per minute, uses all 10 fingers to type, and uses 25 grams of force per keystroke, which is kind of average. They did if you run out all those numbers, it's basically 700, it's grams, 700 grams of force per finger per day. So that's a lot of force going through our fingers. And if you type harder, like use more force than 25 grams, of course, that number is going to go up. If you don't use all 10 fingers, that number is going to go up. And if you're a little faster keyboarder, that number is going to go up as well. So that's a lot of force through our fingers, and can certainly be a source of problems, maybe arthritis and tendonitis in the future. Another important thing about the keyboard, again, I kind of touched on it. You got to make sure you have enough room here between your surface of your workstation and your thighs and knees and legs, so that you're not smashing those. Lining the keyboard up, the B on the keyboard stands for belly button. So it should be lined up with your belly button. That could kind of help you make sure you're not off to one side, which can certainly change the dynamics and positioning of your body. Another thing you can try is to use your left hand. If you're right hand dominant, use your left hand more. So maybe learn to try to mouse a little with your left hand, or do certain tasks that you would normally do with your right. If you can try to spread the pain a little bit between those two hands. And then we get into the monitor. The monitor is kind of a big deal. Do you guys use more than one monitor? Anybody? Yeah. So you've got 2 monitors or more. That sort of, if you have this wide workstation where you're turning your head to look at both your monitors, that can cause a lot of repetitive strain in your neck. So where to place your monitor? You have basically this field of vision that's about 30 degrees from your eyes. If you're just using one monitor, it should be placed. Where should it be placed? It depends, basically. Depends on the size of your monitor. It depends on the size of the font that you're using. That's a big issue. Depends on what your vision is like. You have poor vision, obviously you'd want it a little bit closer. If you are using more than one monitor, this is kind of an interesting task or trick to figure out where to place it. If you use both of them the same amount of time, having them both centered is best. But if you have one that's sort of your dominant monitor and one that you just kind of look at occasionally, the best thing to do would be centralize the one that you use the most, and then the other one should be at a 30-degree angle from your field of vision, and it should be on the dominant eye side. So what's your dominant eye? So try this. So put the clock in a triangle that you make with your fingers. So arms stretched out all the way. Okay, now it should be right in the center of your triangle. Now close your right eye. Does the clock stay in that same spot or does it move? It moves. Okay, now close your left eye. And does it move when you close your left eye?
Yes.
Yeah.
So whichever eye that clock stays in the center is your dominant eye.
What if it moves on
What if
both?
it moves on
Yeah.
both?
I had someone, both my husband and my daughter would same thing. It moved on both. I would say you're probably more, and this is again, I don't know the research on this, but my guess would be you're a little bit more unidominant or bidominant, I guess would be the right way to say it.
And
Like-
one eye may not move it quite as far as the other, and that would be your more dominant.
I'm left eye dominant, but I'm right hand dominant. So it's very clear for me. It completely moves when I close my left eye. So that gives you kind of an idea of which eye you're sort of relying on course of the day. So yeah, I would say whichever one it moves the most, then that's probably your non-dominant eye. So that second monitor should be at a 30-degree angle on your dominant eye side, so that you're sort of making your head and your neck work a little bit less. Another trick on placing your monitor would be just read something from your monitor. If you lean forward or you kind of turkey neck it, then you're probably not in the right spot. You need to think about raising it a little bit. You need to think about moving it forward or backward, depending on how you look. Because if you're turkey necking, you're getting a lot of strain and force on that cervical spine, on those shoulders. So let's see, what else do we want to cover here? Yeah, keeping your ear over your shoulder is a good sign that your monitor is in the right place. Okay, so next one. This is the ErgoBrace sheet that you guys all have on your second page of your handout. This one, I found this and I love it, because a lot of times as a hand therapist, I tend to really focus on the upper body and the upper extremity and the cervical spine. And I forget sometimes about the legs. And what are the legs doing? What are the hips doing? And all of that is really important. So we're going to do these stretches together. These are really great to do to increase blood flow, decrease fatigue. And it's a good sort of thing to do throughout the day. You can use your phone to set up a schedule. You can do it on the half hour. It's probably a lot to do every half hour. I think that's probably unreasonable, but if you should be moving every half hour. Every 30 minutes, you should be standing up and changing your position. It should probably be a little more frequently than that, but I don't think, every 15 is probably not reasonable. So pick one of these and maybe you can cycle through them during the course of the day. Like, at 9:30, I do the first one, at 10, I do this one, and then sort of spread it out. But it's great to do throughout the day. It's going to increase blood flow back to those muscles. It's going to help stretch them out a little bit, contract, relax them a little bit, and help get some of those nutrients in and some of those waste products out. So the first one, and again, this piggybacks a little bit with what Tim was talking about with the some of the forearm stretches. So the first one, go ahead and extend your arm out in front of you. Your fingers are facing the floor. And then what you're gonna do is grab with the other hand and pull back on your fingers and your wrist. And this is important because we use our finger flexors to type. Now, this could hurt if you have nerve issues, so there's a little caveat there. So if it hurts, just don't pull back quite as far. And you might not want to lock out your elbow just a little bit. Keep your elbow a little bit bent. You want to hold maybe 10, 15 seconds and then let it go. Okay, just one is fine. Yeah, if it hurts, just don't pull it.
Start with just your wrist, let your fingers be relaxed. And then as that gets looser, then you can go into your fingers. And that might not hurt quite so much. It
Yeah,
should feel good.
It feels really good because again, you're using those to write, you're using those to type. And don't forget the other side. Just because you're right hand dominant, don't forget to do it on the left side as well. Next one is a hamstring stretch. And this one I love because again, I forget to do these. So stand up and then what you're gonna do is put the heel of your foot into the ground, lifting your toe, and you're gonna bend. Now, this is important. Don't bend at your waist, bend at your hips. So it takes that strain off your back and then look up and bend forward. You feel that? Your hamstrings get tight by sitting at the computer all day. And this is just a wonderful stretch. And then again, don't forget to do both sides. Yeah, this is a great one because they're big muscles, so you're getting good blood flow with these big muscles. Janessa needs to stretch more, I think. All right.
Tell people to hold.
No, the sheet says 10 to 15 seconds, so that's what we're going to stick with. All right, the next one is the wrist and fingers. So again, this is the one I teach for my tennis elbow patients too. So extend your arm in front of you, pretend that you're holding a beer or a soda, and you turn it over, you're pouring it out on the ground. And then you bend your wrist forward, and then you grab onto it and add a little overpressure. So again, if it hurts, don't push as hard or relax your fingers a little more. You feel it on the back side of your arm. Yep. Yep. So this is a great one for kind of piggyback with what Tim was saying about his the tennis elbow stretch. So that's a good one too for your wrist extensors and your finger extensors. Okay, the last two are wonderful as well. Stand up again for these. So what you're gonna do is put your hands on your hips, and you're gonna take a deep breath in, and you stretch back. You extend your back and bring your shoulders back at the same time. So this one's good because we tend to get into this forward head, sort of rolled posture. And this sort of opens up our chest and it starts to strengthen those back muscles a little bit.
If you don't feel a stretch.
If you don't feel a stretch, you're probably not tight.
That means you do too much.
Yeah.
I'm not doing anything.
Yeah. So take it and hold it though. So you go from here and you extend your back, open up your shoulders and kind of push your hips forward a little bit. So that's going to stretch out your abs a little bit and tighten your back and stretch your chest. Okay, and then the last one, your hands are on your head like this. Okay, and then you're going to take a deep breath in. And as you exhale, you bring your arms to the side and squeeze your shoulder blades together. And again, it's stretching out that pecs and it's getting you out of this posture that we're in all day long. So they just feel awesome. I really, really like these. And they're simple, they're easy, and you can do them sort of kind of intermittently through the day. All right, we have a couple more minutes, so let me just see if there's just a couple little pearls of wisdom. Computer monitors are best placed when they're perpendicular to a light source. So if you have your monitor like right in front of a window or windows right behind you, probably going to cause some glare on your screen. So just kind of be aware of that. They do make anti-glare screens and stuff, but if you could even just twist your monitor a little bit or change which side of the desk you work on, that can make a big difference. Using blinds to close those behind you can really help so you don't get glare. The 20-20-20 rule is really helpful. So every 20 seconds or every 20 minutes, take 20 seconds to look at something 20 feet away. And that minimizes eye strain. So that 20-20-20 rule can really help with those of us that are just looking at a computer screen all the time.
You have to have different ringtones for all the timers.
Yeah, exactly. But say, it's the bottom of the hour and you're going to do one of these ergo break stretches, and you're also going to do your 20-20-20 right then. Done. 20 seconds. It's not going to be a big chunk out of your day. Using a task light on your work can help. And then document holders, if you're going to use one, make sure that you use some of those same concepts with placement of the monitor. Use it with your document holder, so you're not leaning forward to try to see your tiny print on your document as well. So a lot of those same concepts apply for that. Pushing off the desk, to scoot yourself back. If there's not a waterfall edge on the desk, if it's not rounded, that could cause strain to your nerves and muscles in your hands. So you want to keep an eye out for that. Maybe use more legs and less the palms of your hands. And then the last thing I just wanted to mention was job task rotation. If you're doing a task repetitively, you might want to switch that up a little bit and do one task for a little bit and then switch to another task and then to another task if that's possible, to kind of give those muscles a little bit of a break from that fatigue. All right, any questions? Yes.
Do you have any tips at home? Like if people are gonna do big projects or weekend projects, weekend warriors, what you would tell them?
Well, the first thing that popped in my head was like home workstations.
Yeah.
Laptops are the devil. I mean, they really are, because how could you possibly be in that good position with everything at the same level? So external keyboards, and Carly has one that you can plug in or use so that your laptop can be at the right level for the monitor, but then your keyboard can be in the proper level. I think, as far as like home craft projects and stuff, I think it's the same thing. At least I do, I get really into what I'm doing, and then like 3 hours go by and I've been doing the same thing, and all of a sudden I'm, maybe I'm sore or tired. Task rotation, I think would be helpful in that situation. Wearing glasses. I just had a patient, he's 44, and I gave him his splint precaution sheet, and he's like this, and I was like, where are your glasses? He goes, oh no, I'm not wearing those. I'm like, you're 44, you have to. And he's like, no, I'm not doing it. I'm like, all right, well, you're gonna have eye strain then. So wearing glasses, if you use reading glasses, wear them. And I would say, making sure your workstation helps you sit like our little guy here. Oops. Even when you're crafting or you're doing letter writing or something like that at home.
I was gonna ask you about the forearm
Yes.
angle compared to the elbow.
Mm-hmm.
I always heard that it was supposed to be slightly extended, like a waterfall position, and is that not in vogue anymore?
No, it is. It is.
Okay.
It's really a matter of comfort for the person. Armrest can be bad, obviously, because you're resting all those, median nerve and all your arteries and so forth and your flexor tendons themselves. But and it could be more helpful to bring it down a little bit because it does take some of the strain, especially when you're reaching those back keys. But I think between 90 and 120, maybe something like that would be, the best possible.
Can I just add on that? The problem with 90, I've heard both too, 90 and 120. The problem is you've got to have the keyboard angled if you're going to do more than 90, because if you're here and your keyboard is flat, you're going to end up doing this. So you've either got to have a keyboard that has a negative tilt, or I usually tell people to bring in a folded face towel and put it underneath the spacebar part of their keyboard to tip it a little bit, and then you can get into that straight neutral wrist with the elbow extended, because otherwise you end up with wrist extended. Can I add something for the kitchen on what you're talking about home setup? So our kitchens are usually set up for 5, 6 or higher for the counters, or taller, I should say. And those of us who are height challenged, when you go home to chop on your husband's counter, they're up like this, which is using those shoulder elevators that we're telling you not to do. So it's a good idea to get a aerobic step that brings you up, which means your work level, your arms can come down your work level instead of you being up like that.
Nice.
I have a quick question.
Yeah.
So, this hand in particularly, I feel like I get the chills just in this arm, and then I just put my hand either up or let it down, and I just feel like my whole blood just going everywhere. Is that is it because of the way I'm standing, or because I'm using my arm too much? Or?
I think in that case, you really want that corner stretch that Tim showed you. You want to try to work on that a little bit. And the one where you open up your chest a little, you may have some tightness a little higher up here where your artery and vein kind of run in a tight spot. So maybe stretching, and then we could show you another pec stretch that would be helpful. Try that, and then also just make sure, do you remember the scalene stretch that he was showing you kind of with your neck?
Yeah.
You can kind of stretch that out a little bit. That would probably help too. So maybe just a little bit of tension up a little higher that is squishing the artery and vein.
Okay.
Yeah, that's a good one. Any other questions? I hope it was helpful.
job.
Thank you, guys.
Now I'm gonna tell my team, every 20 minutes we're stretching.
There you go.
Wow, you did learn something.
You know, do you have anybody you want to give these to? Maybe
I'll give it to the
hand that-
girl.
There you go. Yeah.
Well, you guys didn't do a sign in. Do you do a sign-in sheet?
We didn't,
I've
but we
never
could.
been to one. I was just curious.
Yeah. Good.
Here.
Oh, yeah, you bet.
Thank you.
Just thinking.